Hey, welcome back to The Dive. Joining us today on the show is Adam Deffett from Ketamine One. But before we get into it, I'm just going to quickly remind you to tap that subscribe button down there. Hey, Adam, welcome to The Dive.
Hi, Cassandra. Great to be here.
Yeah, thanks so much for joining us. Okay, so as we do with all of our new guests, what's the high-level 2-minute elevator pitch for Ketamine One?
Yeah, Ketamine One's a relatively new company, and our strategy has been to acquire existing assets in both Canada and the US. So we are not a drug development company. What we're focused on is the critical infrastructure for delivering new mental health treatments to people. The assets that we've been acquiring are clinics across Canada and the US. We've acquired a network of clinics in Canada that we will be integrating into the broader Ketamine One structure and expanding the services that they offer. In the US, we've acquired a ketamine clinic in Houston, as well as signed agreements for 2 clinics in New York and another clinic in Miami. And so within the next few weeks, we expect to have a network of a total of 19 clinics running across North America in major centers. The other key asset that we've recently acquired is a company called KGK Science. It is a contract researcher and clinical trials company. It has a 23-year history based out of London, Ontario. They have an incredible experience with clinical trials and studies across pharmaceuticals, nutraceuticals, cannabis, and more recently psychedelics, where they're working with 5 different companies already, 2 clinical trials underway. And we see that as another important piece to the puzzle of delivering new treatments to people, specifically within the mental health and wellness space. So we're not betting on any one specific drug or molecule or one indication or trial. We're providing the infrastructure that all of these companies are going to need, we believe, and we believe a number will be successful. But those are all going to require the research capabilities that we have and ultimately the clinical network that we have to be able to deliver these to patients.
So as you mentioned, you recently completed 2 important acquisitions. Can you walk us through the strategy with the acquisitions?
Absolutely. It's our belief that in this space, there's a number of reasons why you want to be acquiring instead of building. The first and foremost is that there really aren't enough qualified individuals to be able to administer all of these novel treatments. We think we're very fortunate in the assets that we've acquired in picking up some of the best and most experienced healthcare professionals in order to be able to do this. In order to build out your own clinical network, you need to first be able to acquire those people, and that's not easy to do in this environment. And so we've been acquiring clinics that are operational, that have a history. Part of our criteria is looking for clinics with at least 2 years of experience. The clinics we've brought in so far, for the most part, have well beyond that. For example, our New York clinic, we're very excited about this. Run by Dr. Brooks in Manhattan. This clinic has treated over 4,000 patients, and we think it's the leader within the US. And so, part of our strategy has been to find clinics with experienced operators, but there's also going to be, versus a build out, we can hit the ground running immediately. We've got patients, we've got significant revenues coming from these clinics, and so it's not just about the number of clinics, it's about the number of patients that we're seeing on a day-to-day basis. And so within the clinic space, I think that's a key differentiator. It's not about just opening up clinics, it's about bringing clinics into a network where we can leverage, both the staff and the patient base that's already there. Within KGK Science in our clinical research side, what we've done there is bring in a very experienced company that has a lot of background in clinical trials. We know that psychedelics right now are really just experiencing a renaissance. the number of clinical trials that are planned, the number of new companies is growing exponentially. They need a experienced provider to not only complete these clinical trials, but to design them, to build out the regulatory framework. And that's what KGK Science does. And so they are already working with some partners, have a number of other proposals out for future clinical trials. We see being able to integrate them with our clinical network and being able to do trials right within our own network and existing patients and practitioners. And so, we're building the piece of the value chain that goes right from the design of clinical trials right through to the clinical care for patients and even beyond the clinic.
Great. Okay, so let's talk about the move to the NEO exchange. What was the reasoning for choosing the NEO?
Well, we were looking at rapidly building our business and wanted to be on a platform that would best enable us to do that. The NEO is a senior exchange. That was one of the key criteria for us, but they've also been incredibly innovative in their products and what they're doing, and have really been able to attract a lot of other companies within the psychedelic and broader healthcare system. We thought it was a good place to showcase Ketamine One, which is our rebranded company. We were formerly Myconic until a few weeks ago. So we wanted to uplist to a senior exchange and be somewhere where we felt best showcased what the new company Ketamine One was about.
So shifting gears here, you recently announced the Mindscape facility is now introducing and exploring immersive virtual reality. For our viewers, can you share with us what IVR is and its benefits?
Absolutely. Mindscape is the clinic that we acquired in Houston, Texas. It is really been a leader in terms of adapting and integrating new technologies into its ketamine treatments. One of those is that it's been using virtual reality within the clinic as part of the treatment sessions. Now, this is something that's offered to patients. It is optional, and when we try to, and when Mindscape has been very cognizant of matching this up with patient experience and what they're looking for. What they've found in the use of virtual reality is that it helps in a number of ways. It helps in pre-treatment and preparing patients for what to expect. It helps with some of the anxiety potentially around things like getting a needle, which we know a number of people do have. And then it really enhances the treatment as well. Within all psychedelics and ketamine as well, we know that both set and setting are very important pieces of the overall treatment. And this immersive virtual reality helps enhance the set and the setting. And it gives people, something that allows them to explore. It gives them a safe and calm space, and it's something that they're able to personalize as well. And so what we've done with Mindscape and what that announcement was about was to further enhance what they were doing, look to build out our own proprietary virtual reality experience, integrate it more within our treatment, and as well do some trials on it to better understand the effects and how we can enhance patient care. So we think it's an important addition to therapy. It has the potential to enhance it for those that choose. Again, this is something we're allowing patients to choose and dictate on their own terms, and really more personalize the treatment. It's about finding the right treatment for each individual that comes through.
It sounds like technology and advancement are your main goals. Will the patients know the difference between IVR enhanced therapies compared to the traditional ones?
We think absolutely, and it's our goal really to expand and continue to work with new technologies to allow that customization of treatment, to give patients a more comfortable setting when they come in, to relieve some of the anxiety, and really our main, I should say, an additional goal is to be able to move that out of the clinical setting as well, and offer certain technologies that will continue to help patients as they advance within their treatments and within their clinical providers. And so I think patients will notice a big difference in terms of being in an immersive environment that offers virtual reality. And we're looking to continue to add on more technology to that as well. Other therapies, other sensory experiences within this, all additive to the overall treatment process.
Wow, very cool. Okay, so where do you see the future of the overall ketamine space in 5 to 10 years?
That's a great question. I think there's two parts to it. I think one is, what does the ketamine space look like in 5 to 10 years? But for us, what does the broader mental health segment look like? Because we know it's not going to just be ketamine. There's a lot of other exciting studies being done, other psychedelics, other drugs that are being studied, trials going on, even developments of new molecules. And so we think right now ketamine is a great starting place for that. It's an extremely well understood drug. It's been around for over 50 years. It's used globally as an anesthetic. So practitioners are comfortable using it. They understand the side effects. It's been studied extensively. And so it can be used very safely. As new drugs get developed, we know that they're going to need clinics as well. And we're going to be at the forefront and have the largest network to be able to deliver those new molecules to patients. And I don't know what that timeline will be. We hope it comes sooner rather than later. But I would say definitely within that 5 to 10 year time frame that you mentioned, we think there's going to be a number of other molecules that are available. But ketamine will continue to build out. It's seen a lot of growth, especially in the US already. It's gaining a lot of acceptance in terms of the types of treatment and people that it's effective for. And there's additional studies being done every day on it as well. And so we see a lot of growth for both the ketamine market, for psychedelics and other molecules, and then mental health in general is unfortunately a massive growing industry because of the need for mental health resources. Things like COVID have only exacerbated that need, and people really looking for different treatments. One of the other reasons why we are really passionate about ketamine and other molecules is that there really hasn't been a lot of innovation within treatment for things like depression in decades, especially when it comes to the drugs administered. And so we do believe that the work being done now is going to usher in a lot of changes. Again, we want to build the infrastructure that's going to be necessary to develop and administer all of these potential game-changing drugs.
Okay, so last question here, Adam. Are there any events that investors should keep an eye out for on the second half of the year?
We've been really busy already as a very young company. We plan to continue to roll out our strategy of acquisitions, I would say especially focused on the US, given the critical mass we already have in Canada. We're looking to close our clinic acquisitions, both in New York and Miami in the short term. So those would be two things to definitely watch out for. I am going to expect that our KGK Science division on the research side will continue to win new contracts that will be exciting about working with other companies within the psychedelic space. And our strategy, again, is to roll up more assets in more clinics, existing clinics that come with a strong operating history as well as medical professionals. It's our goal to have a total of 30 clinics by Q1 of 2022. And we do think we have the visibility to get to that number, which would solidify us as the number one player by far within mental health clinics. And we believe we've got the visibility to get to that number of clinics, if not greater.
All right, well, thank you so much for joining us on The Dive today, Adam.
Thank you very much for having us.
Thanks so much for tuning in today. I'll be back tomorrow, so don't forget to turn that notification bell on.